Welcome to the Brilliant Board Review Podcast, your trusted source for high-yield board prep, CME, and the latest in clinical medicine.
Now let's talk about duration for bloodstream infections. How long to give antibiotics for? And basically the study is looking at 7 versus 14 days. Now this is part of the trend for change. We all know that antibiotics, the duration was based off a calendar, which there was no specific studies. We said, hey, 14 days sounds good. It's good for people to have 14 days of antibiotics. We all know the side effects of antibiotics, but also, too, is people are longer in the hospital. This costs more to the system. And then you're in the hospital, things break. People trip, they fall, they slip and they fall. They have injuries in the hospital, and it's better to get them home as soon as possible. What we're looking for is primary outcome by death by any cost after diagnosis of a bloodstream infection after 90 days. This is a multicenter, non-inferiority trial. When this is patients, we're looking for patients in the ICU with bloodstream infections. This was done by the Canadian Critical Care Trials Group, so not a drug company. Excluded. Now, this is important. This is very, very important. Who is excluded? Immunosuppressed patients, foci requiring prolonged treatment, single cultures with possible contamination. So meaning there was contamination, so they took them out. And then this is the big one, Staph aureus. So depends where you practice. You may get a lot of Staph aureus, so this would be excluded. It was 74 hospitals in 7 countries, and it was 3,608 patients. 55% were in the ICU and about 45% in the ward. So this is a pretty good mix. Now, if you look at the mix of infections, 42 were UTI, 18 were abdominal infection, 18% were abdominal infection. Lung percentage was about 13%, and vascular catheterization was, catheter infections was about 6.3%. And guess what? There was no difference. So between 7 and 14 days, and then there was a signal for more C. diff in the longer group, which would make sense, and then signal with more problems with the antibiotics, side effects of the antibiotics, and the patients are taking it longer. So is this practice changing? Probably, but who was excluded? Immunosuppressed. Certain patients who needed prolonged treatments due to specific things. The ID doctor says, man, we could look at that. Would be what? What would be one of those endocarditis? Endocarditis would not be in there. Single cultures with possible contamination, we just throw those out. And then Staphylococcus aureus. Now, depending where you practice, there can be a lot of Staph aureus where you work.
Thanks for listening. Visit brilliantcourses.com to learn more and claim credits for this educational activity. See you next time.